Yep.
All right, let's move on because March is Kidney Awareness Month. We want you to know 26 million Americans have some form of kidney disease. Many will never know it until it's progressed to a later stage and then so difficult to treat. But there's a new study on kidney cancer that finds treatment might actually be worse than the actual disease. Dr. Siegel, again, what to do?
Well, you know, and there's 100,000 people waiting for a kidney every year, and that's the end of the spectrum. People that have got to the point where they have end-stage kidney failure. But for me as an internist, what I do is I screen the urine. People come to my office, I want them to get a urine analysis. Why? Because by the time kidney function has deteriorated, Jamie, to the point where you can see it on a blood test, a lot of the kidney is already affected. You got to do it with the urine. Now, with the urine, it's pretty sensitive. If there's blood cells in the urine that aren't supposed to be there, I might say, send the patient to Dr. Samadi or a urologist. Maybe there's a kidney stone. Maybe there's another problem like kidney cancer. Why do they have blood in the urine? If there's protein in the urine, that's a sign that there's a problem. I treat a lot of diabetics and people with hypertension. Those make up the bulk of people with kidney problems. If you're a diabetic out there or you have high blood pressure, you've got to be thinking about your kidney. What can you do to prevent kidney disease from developing? Controlling blood pressure is number one. Controlling diabetes is number two. Diet can play a role. There's some controversy on that, but diet that's low in salt. David talked about salt yesterday. Diets that are low in salt can help with the kidney. Low in protein may help.
Let me ask you this, Dr. Samadi, because I remember there were drugs like, it's off the market right now, but it was called Vioxx. It was anti-inflammatory, and those, taking drugs like that, could affect your kidney function. Many people suffered.
Yes.
So when you go to the doctor, if it's undetectable many times, what do you ask the doctor to make sure that all the medications you're taking, your diet, your history, is not going to cause a kidney problem?
That's a very good point, because besides diabetes and high blood pressure, medications is another risk factor. And we've talked about gentamicin and vancomycin, Vioxx, and all of these medications that we call them nephrotoxic, meaning that they're toxic to your kidneys. So you want to bring the list of all the medications and your doctors to be aware. Kidneys, which this month, March, is a National Kidney Disease Month, doesn't get enough publicity. The kidneys are these two beings that sit behind the body, but they play a very vital role, Jamie. They regulate our blood pressures. They are involved in the vitamin D and bone health. They are involved in our red blood cell, etc., and your water and salt balance. So they're very important. And treating your blood pressure and controlling diabetes are absolutely very important. We talked about kidney cancer just briefly on that. There was a study that came out that we're operating a lot on these kidney cancers. A lot of them are small masses on the kidney that we can watch. So older patients, 70-year-old comes in with a small mass, I rather watch that patient and not operate. If they're younger, we may go into what we call a partial removal of the kidney and save as much of the kidney for them.
Great. There's hope for kidney patients.
Great advice this morning.
Thank you.
And no salt for you, Eric.
No salt. Don't
Can you remove a kidney robotically, David?
Yes, you can do it actually robotically and minimal invasive, and that's a very good point. Nobody should remove the entire kidney as much as you can and save as much of it to prevent dialysis and transplant. That's
Very
Marc
interesting.
mentioned.
Didn't know that.
All right, yeah.